Hi, my name is Yolanda Mavity, and I'm a physical therapist at Torrance Memorial Medical Center. We're here to talk about how to take care of your knee after ACL reconstruction surgery. In this video, we will review post-surgical goals, precautions, and exercises for optimal recovery. An ACL reconstruction surgery is done to repair a damaged ligament, and for this reason, our primary goal during the first couple of weeks of rehab is to protect the graft. The next goal is to minimize stiffness and swelling of the knee. And our final goal is we want to improve strength in the surgical leg for a smooth rehab. Wearing the knee immobilizer. After surgery, you will need to wear a knee brace. This brace should remain on at all times, except when bathing and when doing some exercises. Make sure that the knee brace is tight enough so that it doesn't slide down your leg when standing, but not too tight that it is uncomfortable and affects circulation. During the first 2 weeks after surgery, you will need crutches to help you walk, and the knee brace locked in extension, straight, until you gain enough strength in your leg to stabilize the knee. After 2 weeks, you may start walking without crutches, as long as there is no increased pain. When not walking, the brace may be opened up to allow the knee to bend to 90 degrees. You will use the brace for the first 6 weeks after surgery, or until good quad control is achieved. Your physician or physical therapist will let you know when this is achieved. Wound care. Before we take you through rehabilitation exercises, let's first discuss wound care and how to manage swelling of the knee. For the first 48 hours after surgery, you should wear the white compression stocking and leave the white steri strips on the incision. Keep the wounds clean until stitches are removed at the first post-op visit. If you notice white discharge coming from the wounds, please call your physician. You may shower after you remove the dressing, but do not let the incisions soak in a pool or bath. After shower, clean and dry the incisions. To minimize swelling and to help with pain management, place ice pads on your knee for 20 minutes at a time, at least 4 times per day for the first several days after surgery. Do not place ice directly on skin. Use a pillowcase or cloth between the ice and skin, and do not leave it on longer than 20 minutes so you don't cause an ice burn. If you purchased an ice machine, you may leave it on as long as you like. Please notify your physician immediately if you experience any of these symptoms. When to call your doctor. If you have a temperature over 101, problems or signs of infection at the incision site, signs or symptoms of blood clotting, any sudden change in weakness or numbness, severe pain not relieved by pain medications, rest, or ice. CPM machine. To help with knee range of motion, some patients after surgery may use a continuous passive motion machine or CPM machine. If you are using the CPM machine, begin using it as soon as possible after surgery. Start out at a slow speed with settings at -10 to 60 degrees. Work up to 90 degrees gradually. Try to be in the machine 4 to 6 hours per day for the first 2 weeks after surgery. Once you comfortably can bend your knee to 90 degrees, you no longer need the machine. Some individuals may never need to use this machine. Post-surgery rehab exercises are essential for attaining optimal recovery. In the remainder of this video, we will demonstrate home exercises you should do daily for the first couple of weeks after your surgery. It is important to start these exercises as soon as possible after surgery, even if the nerve block is still in effect. Once the nerve block wears off, approximately 3 days after surgery, it is much tougher to move the knee if you haven't already started. Exercise is the best way to heal. It increases range of motion, decreases pain, and improves muscle strength. The more you can do, the better the outcome. However, for all of the following exercises, please consider the amount of pain that you are having and how long it takes to get better. You can expect to have some discomfort with initial exercises, but if your pain level is extremely high, cannot be controlled with pain medications, or does not ease after stopping the exercise, please consult with your physician or physical therapist. The first exercise we are going to demonstrate is the ankle pump. Ankle pumps is a simple exercise that can help with swelling management and prevent blood clot formation. Lie on your back and extend your legs. Point your toes and hold for 6 seconds, then bring the toes back as far as possible. Do 10 ankle pumps per each hour to prevent blood clots. Quad sets. The next exercise is the quad set. This will improve muscle strength. First, lie on your back with the knee extended and fully straight. Tighten and hold the front thigh muscle, making the knee flat and straight. The tightening action of the quadriceps is important to strengthen the thigh muscle for improved standing and walking tolerance. Hold 10 seconds for each contraction. Do 10 repetitions 3 times a day. Heel slides. To improve the bending of the knee. While lying on your back, actively slide your heel towards your buttock to bend the knee as far as you can tolerate. Hold this bent position for 10 seconds and then slowly relieve the stretch and straighten the knee. The goal of this exercise is to improve knee flexion. Repeat 10 times, 3 times a day. Sitting knee flex in chair. For the next exercise, you will need to be seated in a chair. Once seated, slide the heel backwards as if trying to get the foot underneath the chair. Hold this stretch for 10 seconds and slowly relieve the stretch by sliding the foot forward. You can help with the opposite foot if necessary. The goal of this exercise is to regain knee flexion. Repeat 10 times, 3 times a day. The next exercise is the knee extension that will help improve straightening of the knee with the goal to achieve 0 degrees. Once again, lie on your back with a rolled up towel under your heel or sit in a chair with the heel on a stool. Let the knee relax into extension straight. Try to hold this position for 5 minutes, 3 times a day. While maintaining this extended position, practice your quad set. Do not put a pillow or towel under your knee. Hamstring sets. Let's stay lying down for the hamstring set exercise and begin by bending your knee to 60 degrees. Next, press your heel into the ground and hold. You should feel hamstrings and quads tighten up. Hold for 10 seconds, relax, and repeat 10 times. Do this 3 times per day. Straight leg raise. This next exercise may not be achievable right away, but continue to try until you are able. Begin by tightening the quadricep muscle so that the knee is flat, straight, and fully extended. Try to raise the entire operated limb off the floor or bed. Raise the limb to about 45 degrees, pause for 1 second, and then lower slowly to the bed, keeping the knee straight. Relax and repeat. If this is too painful to lift the leg, or if the knee bends when you attempt to lift the limb off the bed, please hold on this exercise until you are able to do so. Keep trying to do the quadriceps setting exercise until you can lift the limb without letting the knee bend. Repeat 20 times. Standing gastroc and soleus stretch. For the next exercise, you will remain standing. Start by facing the wall with the non-surgical leg in front, surgical leg behind with the knee straight. Lean forward with the hands against the wall. Keep the back of the heel on the floor. Gentle stretch should be felt in the calf muscle. For a soleus stretch, bend both knees, keeping the heel on the floor. Stretch will also be felt in the lower calf area, slightly different from the gastroc stretch. Standing heel raises. For the next exercise, remain standing and face a wall or countertop for support and balance. Keep the knees extended fully. Tighten the quadriceps to hold the knee fully straight. Rise up on tiptoes while maintaining the knees in full extension. Hold for 1 second, then lower slowly to the starting position. Repeat 20 times. Side-lying hip abduction. For the last exercise, you will need to be lying on your side. Begin by slowly raising up your top leg to the side. Keep your knee straight and maintain your toes pointed forward the entire time. Keep your leg in line with your body. The bottom leg can be bent to stabilize your body. Repeat 10 times. Perform 2 sets. Wear knee brace locked in straight if you're having difficulty keeping the knee straight or having knee pain. The purpose of this exercise is to strengthen the hip muscles, which help with walking and controlling the knee. The key to optimal recovery is to consistently practice these exercises daily. Thank you for taking the time to view this video. At Torrance Memorial Medical Center, our goal is to provide personalized patient care to help achieve optimal recovery and get you back to what you love to do. We encourage you to practice these exercises daily. For more information, please refer to your post-surgical rehabilitation education materials. For additional information, visit our website, torrancememorial.org, or contact our rehab support team at 310-517-4735 to speak to a member of our care team. Thank you.